Hello and welcome back to my channel, The Mass Resident. I am Dr. Meharish, but your friendly neighborhood general surgery resident who's almost done with the residency. So, trying to wrap up a lot of information that I have accumulated through experience of being a resident and applying into residency and being a medical student, I don't know what not, and just trying to put all of this stuff out there to help whoever I can in whatever situation of life they are in their medical career path. So this is a video that is a little bit different from the ones that I usually do. So the people who have been following me for a while, they do know that I talk a lot, or a lot of my videos are really based on the process of applying into residency, of the process of getting through residency, of getting to residency, and from before, like all the stuff about failures and like motivation and etc etc. But this is going to be a little bit different, still around the same lines. This particular video I wanted to put out there because I feel like I have a lot of things to say about this, and I have spoken to a lot of people in general when they come and approach me for advice related to this subject matter. So I thought, hey, you know what, why not just make a video of it? And anyways, I needed to schedule a couple of videos and I was looking for ideas, and I thought this is like a pretty great idea that I want to put out there. So this particular video is gonna be on how to crack medical MCQ exams. Ta-da! So why I think that my 2 cents on this matters is because if you go back to my journey till here, you will know that I'm an Indian grad and I actually had to repeat a year of entrance coaching to get into medical college in India, Kerala. And I did that in an entrance facility called Brilliant. Now, if you want to know more on that story and all of that, there's a very long get to know me video on my page itself. It's called Get to Know Your Source, and about my roller coaster journey. So please go through that if you really want to know everything from A to Z. But I just gave you a bit of context as to that part of my journey here because I wanted to let you know of the amount of experience I have giving exams. So for those of you who have already gone through this entrance grinding wheel, repeating grinding wheel, and for those who are actually currently preparing for entrance in India through a coaching center and all, will know how focused or how dedicated these coaching centers are to make you very, very ready for your exam day. And I can't talk for the other coaching centers, but I do believe they work in a similar format, though what I'm saying right now will be kind of because of my experience in Brilliant itself. So when I repeated my 1 year to just study and practice and prepare for the entrance examination, the kind of the kind of structure that they put us through was that every week we used to have an MCQ test. Now this was mostly like a class-based test where you're tested amongst your peer. Like they used to have these there were I think 3,000 plus students in the institution at one point of time. So we were divided into clusters. So you have cluster A, B, C, D, and then in under A you'll have A 1, 2, 3, 4, 5, 6. I don't know how many numbers there were. So it was one of those things where every week you're kind of tested between your clusters, and I believe every month or every other month or something you're tested in a bigger group. So like A to Z or A to G or whatever. So bigger exams, right? But the short message of this is that we were giving exams at least once a week, and with people who are solely preparing for this one particular goal of getting into an exam, of getting into medical college through the entrance examination. The thing about these exams is that these exams are competitive exams, right? So it's not just enough that you actually study to pass or get a reasonable score for your own benefit or whatever. You actually had to beat the other person. It was a very competitive environment, and I could call it like a bit toxic as well, where you kind of like pit it against each other and like every person is your enemy. And we did face that really when there are people who didn't want to share their notes, who didn't want to like engage in group study and share their knowledge of what they have, because hey, I'm your competition, you're my competition, why should I say anything that helps you? Anyway, that thing aside, So this was like usually a competitive exam where you not only had to score well, you had to score better than the other person, which meant that every answer or every mark or score point you got in the test mattered. Not only was though these exams actually graded like, oh, you get one answer right, then you get +1 mark. It was also graded negatively. So if you get an answer wrong, you get a -1 mark from the marks that you already collected. So you always had to be really careful about like answering the questions you know, and trying not to answer the questions which you like don't know. So if I don't know something completely, I could guess, and that could 1 out of 4 options or 1 out of 5 options chances come correctly. So to avoid that bias, to avoid guesswork and people getting through, they had this negative scoring mark. But the negative thing was also distressing, because you could have a rough idea, like let's say there are 5 options, and you have enough knowledge to know it's between A and B, and A and B options are so close to each other, but I really can't pick A or B. Maybe it's A, maybe it's B, and then you hope to God and like cross all your fingers and then click B, and then unfortunately B is the wrong answer, and then you get 1 mark reduced. So it was a lot of stress as well, which is why they actually train you in these centers, not just in like, they don't just teach you, like obviously we had amazing panel of teachers and who teach really well, go really down to the nitty-gritty in details, and like teach you subjects from the basics. And I never studied my grade 11 and grade 12 subjects as deeply in school as I studied during entrance coaching. That's when they really broke it down and made you understand the concepts and made you understand everything like about it, and really digest those concepts and that the theory and everything. So that was one part of it, just making you like good in terms of your knowledge. But a very important part, and I would even say the more important part for them, was to make sure that you are exam ready in terms of cracking these exams. Okay. And how they did this was obviously through consistently, repeatedly making us sit for these exams. So like I said, every week we were tested, and closer to the exam dates we were tested more frequently and in amongst more people, and just made us really good at cracking the exam pattern, if you know what I mean. Now the thing is that when you give so many exams and so frequently, you really realize that the exam is not about knowledge. Of course, it's a lot about knowledge, but a particular exam has a particular trick or a pattern or a blueprint to it. And that's the blueprint that you have to kind of grasp and learn how to crack. Okay, now I'll give you an example. When you go through entrance examinations, right? When you go through the past papers of the entrance examinations, and you go through so many questions that you lose count, you'll realize that, hey, there's a certain pattern of questions that are like similar. So if you see one pattern, you'll know that I've had a similar pattern question repeated maybe like 100 questions ago, and in that they had given this kind of option just to trick me. So those are called, like, I forgot the exact terminology we use for that, I'm sorry. I think they're called distractors. Yeah. So those options which seem like the right option or seem like the possible right answer is actually a distractor. So you will start noticing a pattern, and this is not something that you can consciously do. It unconsciously has to come to you the more you do questions. So as you practice the MCQ questions for a particular exam, what happens is that your brain starts recognizing, creating, and breaking the patterns of these questions. And eventually, after a few hundred questions, you're gonna be able to subconsciously, something will tell you that this is not the right answer. Even though I consciously want to pick this option, I know that this is not the right answer. And then in the beginning, that's gonna feel like a fluke. It's gonna feel like, I have no logical explanation, or I have nothing to substantiate why I think this is the right answer or the wrong answer. But that's the point where your brain has started noticing the pattern and has started predicting these things. And going forward, when you keep that up, you will realize to trust that instinct. So the whole process of cracking the exam pattern is basically as simple as doing as many questions as possible. So you keep doing a lot of questions repeatedly till you get to the point where you start recognizing patterns and your brain unconsciously, subconsciously starts like triggering, starts sending you signals like, hey, don't pick that. That's E is not the right option. And you don't know why, right? And then at that point, you know that, hey, I've hit a milestone. I've hit the point where I've started like doing enough. And then when you go forward, you're going to reach a point where you trust that instinct to be like, okay, and then it becomes a bit more of a conscious thing. And you can even at this point start consciously breaking down patterns. And you will notice this if you are in a group and then you're like doing questions, solving questions together. And then when you have reached that second milestone where you have consciously been able to break patterns down, you might even be able to convey why you think this is not the answer to another person. So that is the point where you can call yourself having cracked the pattern of that exam. And that is the point that you want to reach before you attempt any exam. Okay, now this is my proven secret recipe to having sat for and cracked hundreds and thousands of exams. And since my entrance coaching days, there has yet to be an MCQ exam that has gotten the best of me, meaning that I have sat through multiple versions of exams till after that. Like I've gone through entrance, after the medical college, I've gotten through the MRE, I've gotten through the MRCS, I've gotten through the end of year exam patterns, I've gotten through the university exam patterns, and everything had the same baseline formula that I use of cracking the paper or cracking the pattern of the paper itself. That's not to say that I have no baseline knowledge or I don't know any of the material and I just go in and I just like crack the exam pattern and it works. No, that absolutely does not mean that. You still have to have the knowledge to apply this pattern cracking sort of thing into it, right? So gaining knowledge is also important, which brings me to my second part of cracking any exam, which is the studying part, right? So one is, which I think is most important than studying, if you ask me honestly, is the part where you crack the pattern. Now the second part, which is like I would say give it like roughly 30 to 40% importance, is the knowledge of it all. So the knowledge of it all is very important. Now why, you might think like, I'm saying that 70% importance is for pattern cracking and like 30% importance is for knowledge. So do exams not really, don't they really assess knowledge? I actually don't believe that a lot of exams really assess your knowledge. Your knowledge is something that, yes, exams do assess, but they can't really truly assess, okay? Objective exams have its like, what do you say? Objective exams are there for a reason. They are an established way to test candidates' efficiency and proficiency and everything for a reason, but it has its own faults. And that goes for any exam. I mean, any exam is not a true reflection of what your knowledge is. Certain exams that have a high standard of questions and clinical scenarios and are set by experts and all do have that capacity to assess your knowledge on a very grassroots level. But I would believe that about maybe like 70% of the MCQ exams that you give in your life are just gonna be about pattern cracking and really doesn't stand like an example of how good of a person you are knowledge based. You could be a person who has read so much, knows a lot of theory and like has read every textbook out there, great at patient care because you know all the recent articles and everything, and you could suck at giving exams because you don't know how to pattern crack. And that's the sad part about all of this. A lot of great people who are like very knowledgeable can't really sit well for exams because they don't know what the trick is to doing an exam, and that is not studying. It is knowing to pattern crack. Okay, now regarding your knowledge, if your sole goal is to actually just get that 30% of knowledge that I'm talking about to pass the exam, then honestly, please get out of this field. You don't belong here. If you are studying or if you have been studying just to pass exams, that's not the kind of doctor your patient wants. Okay, you should be studying for your patients. You should be studying for your knowledge. You should be studying because the beauty of medicine and the way the body works and the way diseases are treated and everything just like excites you. That should be the reason you are here, because As I have talked about in one of my previous videos, the knowledge is vast, the knowledge is endless. You will never be able to finish knowing everything. And you should always have that thirst to want to know more, to really go dig in deep, and just for your sake, or just because I want to know more, or I want to be able to care for my patients more, or I want to have more knowledge about this. That should be your reason of studying and reading and like researching. That should be what motivates you, and it should not be because you have to prepare for an exam. Because preparation for an exam, as you know, there will be a certain portion or a certain curriculum most of the time. It doesn't have to be written in stone, like before in school days and all, you had this curriculum, like, you know, oh, you have chapter 1, 2, 3, and you'll be tested exclusively on that. Obviously that system doesn't exist anymore, but still, you know that, like, you know, okay, if I have an exam coming up, for example, if I have the MRCS part 1 coming up, then I know that these things or these like topics are the ones that they're going to ask questions from, right? And my goal is to study things from that in order to attempt for the exam. And that, yes, will it add to my knowledge and to my revisions? Yes, but will it really be like something that I am learning so that it makes me better as a doctor or better to take care of my patients? Not really. If I make it like, if I give you with an example, for the MRCS part 1, which I sat quite recently, maybe in like third year of my general surgery residency, there was a lot that I had to revise and relearn about pathology and orthopedics and everything, which there is no way that I'm going to use going forward. So I studied it in medical college because obviously I needed a base and a background idea of how these systems and all work. So I studied it in medicine, and I have that, you know, like rough base is there for all of these topics and subjects. But during my residency, I never had to know, oh, which cell, like orphan Annie I nucleus is seen in what kind of thyroid custom. This does not make honestly any difference to me. It's great to know if somebody says it and I'm like, hey, you know, I know this information, it's good, but did I need it to be a good surgeon? Did I need it to take care of my patients? Did my patients care that orphan Annie I nucleus was detected in their sample? No. So, you know, for my field, that didn't matter at all. But I still had to relearn these facts and these information for the sake of the exam. See what I mean? So there's always a lot of knowledge that you have to actually put in to study for the exam as well. So that doesn't necessarily mean that it's the knowledge that you're currently using. It could be knowledge that you have forgotten, have never learned, but you really have to study for the sake of this particular exam that you're sitting. Now, how to tackle learning this? This is going to be this second step of knowledge cracking. Now, how to knowledge crack an exam is basically not to know the curriculum and read the curriculum. It is really not that. It again goes back to the exam questions itself. So what you do is, let's say you have no idea about certain things. You can always, like, you know, take up one of those summary and pearls and then go through, so you have a very rough idea. But please don't utilize or don't waste a lot of time with these theoretical like textbooks and notes and just like try to revise them. Don't do that. What I would recommend and what I do is that when I know, like for example, again, I'll refer back to MRCS because that's a recent exam that I gave that had a lot of portions which I was like out of touch with. So for example, when I was doing the MRCS, there was like, you know, a textbook and everything, and in that there was chapters on pathology. Now what I did is I just read through. I didn't study it, memorize it, revise it. I just, like as if you're reading a novel or a storybook, but obviously with a certain level of concentration, just read through the chapter very quickly. And then like there are certain things that like I just like even breezed through because I had a better memory of them. Certain things I felt like I was reading for the first time, I read them with a little bit more concentration, but I just read it. Okay, I didn't study it. Again, I'm not saying like I sat and studied and memorized everything. I read it because I was so out of touch with these topics like orthopedics and pathology and bone landmarks and everything. I just needed to like kind of jog a little bit of memory. Now, after reading, what I did is, again, I went back to attempting to pattern crack. When I go to the pattern cracking part where I'm doing multiple questions, what I do is that if I'm able to answer these out of topic questions because of the rough reading I did, great. But obviously, a lot of the time I was not able to because the questions are going to ask you things in much detail. What I do is I note this down. I don't note down the question itself, I note down the topic. For example, if let's say they had asked me a question about all of the following signs are seen in acute osteomyelitis except, and there is A, B, C, D, E, and I figured like, okay, I think I know the answer. I picked B. It was fluke, on a fluke basis, right? But I know that my knowledge in osteomyelitis isn't that strong. So what do? I write down osteomyelitis. So this is simultaneously happening alongside my question cracking, my pattern cracking, right? So pattern cracking is what's actually happening, but at the same time, I'm creating a blueprint for me to knowledge crack, okay? So I'm pattern cracking, I'm doing rapid questions back to back to back, so that like my brain is like absorbing the pattern and subconsciously creating a blueprint. At the same time, I'm using the number of questions that I do to create a blueprint of what are the repeated topics or the topics that they're asking a lot about. So for example, in this scenario again, let's say acute osteomyelitis, I write acute osteomyelitis on a piece of paper, I move on. Then maybe I'll reach a question that's general surgery or anatomy or physiology related that I really know well enough and I don't think I need to go back to. So maybe I will note it down. If I feel like I really still want to revise it for my own benefit, I might note it down somewhere else. And like, I might like even categorize these points. So I might say, okay, must read or have no idea will be like acute osteomyelitis. Would be nice to refresh would be something physiology related or anatomy related, and then something that I really know well will be in like a third column. So each question that I attempt for pattern cracking, I put in the column on another paper, which is going to help me understand what is the topics that are being most commonly approached. Now, I may again encounter another question about acute osteomyelitis in a completely different way. It might be a clinical scenario saying, oh, this patient had so acute osteomyelitis and then this antibiotic was given, but that doesn't necessarily, it's not the same question, but it is on acute osteomyelitis. So then next to the part where I wrote acute osteomyelitis, I'm just going to mark it like ×2 or like, do those jail people 1, 2, 3 thingies. And I'm going to do this for everything. So as soon as I find a topic that's been repeated, I'm just going to go and like mark that, oh, once, twice, thrice, it's been repeated. Now this is going to give me a very good treasure trove of information regarding what are the favorite topics of these exams, okay? And this doesn't build up over one paper or like just a few questions. It's like takes hundreds of questions to create a knowledge blueprint that is reliable enough for you to base your knowledge cracking on, okay? So once I have done enough questions and I find that, okay, fine, a lot of these things now are being repeated, like I'm no longer adding new topics, or I'm adding new topics less frequently. I'm mostly just like marking, like, what do you say? Okay, repeat again. That's when I know that I have a roughly good blueprint for going back and reading, okay? So now what I'm going to do is like, I'm going to approach not the entire chapter or the entire topic, but these specific topics I'm going to go back to my textbook and read really in detail about, and maybe even use another resource or like go online and look up articles or whatever I need to do to make me feel like I have a good grasp of this particular topic, okay? Now, when I say it like this in a broken down format, it might seem very monotonous to you, where you're like doing questions only, and then you feel like, oh, I have no knowledge to do these questions, so I'm just wasting my time. I'm not saying do 500 questions before you start to the knowledge part at all. These are the two aspects of how I've approached all of my exams so far, but it doesn't necessarily mean that it is A followed by B. Like, I'm going to go a little bit general surgeon here, where if you guys are familiar with the ATLS protocol, where we do ABCDE assessment, they will teach you that it's never a vertical assessment, it's always a horizontal assessment, right? So you don't go airway, then you check breathing, then you check circulation, unless you're only one person. You always do a horizontal assessment where you have people checking airway and breathing and circulation, everything almost at the same time. So this is a horizontal approach, where you start with pattern cracking because that is the most important, just like how you start with airway because that's the most important. But that doesn't mean that breathing is any less important, and breathing can just as easily kill you as airway, right? So you start with pattern cracking, and then when you roughly feel like I'm getting kind of saturated with pattern cracking, or I'm getting to the point where I feel like, no, I need to read something, with whatever you have collected in the topics in the knowledge cracking part, you're gonna use that and maybe go read a little bit, take a bit of time off, gather like where you can get information from, organize that part. But always make sure that you don't get stuck there and you always come back to pattern cracking. Now, how often you go back and forth and how exactly you do this will really depend on what kind of a learner you are and your level of implementing this particular protocol. Now, for me, like I said, I've given so many exams and I've implemented this so many times. It's like second nature to me. Whenever I have an exam, this is the only way I know how to prep. I start with this, I start with that, and it's like it's gotten to a really good, great flow for me. So I don't really think twice about it. Usually I see that it's roughly about one paper where I get saturated. So it'd be like a paper usually is like 100 to 120 questions roughly. So that's about the time. So I usually crack one past paper and then like I use that, and then I might go read, and then I go back, take another paper, I go read again. On days when I really don't have any more to read, I know myself that if I read, I will sleep. I will go back to doing more papers that day, so I can like add to this knowledge trove. On the days when I feel like I have extreme decision fatigue from being at work and taking multiple like real life decisions, I don't do too many questions. I go and soothe myself and read into things that I find interest. So I might pick topics that like I feel like are going to benefit me or are good for revision, and then I go back and like read those. So again, like it really depends on how you are, like what your thinking process is, how your day has been like, what your energy levels are like, how you bounce back and forth. But in summary, all you have to know is every MCQ exam, at least in this shortcut, surefire way that I have implemented, tried, tested, and proven since many years, has two breakdowns: the pattern cracking and the knowledge cracking. The processes I will not go through again because I feel like it needs its own explanation. But just know this is not a vertical approach, it's a horizontal approach. So you pattern crack, knowledge crack simultaneously. The tips to remember are that you don't get lost in the knowledge cracking part, or you don't ignore it, because it's also important. And as when it comes to the pattern cracking part, remember that initially it's not going to make any sense, and the more rookie you are into trying this pattern, the longer it's gonna take for you to get that level to where you have that instinct that okay, fine, I've cracked the pattern. It's okay, but start implementing this like from now, so that, because you're gonna have to give a lot of exams, okay? I mean, it depends on what level you are. If you're watching this like me, if you're like at a level like me where you're at the end of residency, maybe you don't have too many exams to give. Maybe you'll have like a fellowship entrance exam, or maybe you have like, or maybe you're not even planning to give an exam and I don't know why you're watching this if you're not going to plan to give any other exam. But if you're in an early stage of your career, like if you're a medical student and all your MCQ exams are in front of you, then try to implement this from the beginning. It may feel a little scary in the beginning if it's not something that you're used to. And again, if you don't want to use it, hey, if you have another system that works for you, you do you, boo. But this is for those who struggle with getting through MCQ exams. This is for those who feel like, oh, I have done so much reading, but still it never reflects in my MCQ exams. And how do I get that score in MCQ exam that reflects how academically bright I am? This is for those people. And know that your MCQ exam, please, it does not reflect how good your knowledge is, or how much hard work you have done. It is just an objective exam. It really doesn't assess much. So that's why I really want to emphasize this point, that the point of the MCQ exam is just to get through it. The point of the MCQ exam is not to build knowledge. It is to get through it so that you can make it to the next step. And that's it. Your knowledge is on your own time, your own interest, and your own dedication towards it. And that's why I keep saying that this profession is not for people who don't like studying. And if you study just for exams, you're wasting your time here, because it's pointless. If you're going to study just for the exams, you're not going to be a great physician. And honestly, you could be a very great physician and suck at exams. This is for people who want to do both. Okay, so for people who want to do well as a doctor and like do the best they can knowledge-wise and skill-wise and everything for their patient, but at the same time also be good enough on paper so that they can clear and achieve their goals, and they can get into the residencies and get into the fellowships and pass those exams and get those licensing and whatever. So yeah, this was just like I said, a break from the usual things that I talk about. But I hope that if you're watching this, this is something that you feel like you can implement in your life or in your MCQ exams, and then this is something that you will feel like has helped you. And if it has helped you, if it is helping you, if you try this method and if you feel like, hey, this worked for the first time in my life, my MCQ scores reflects the amount of work I've put in, please drop a comment below. It'll make my day if you tell me that this has worked for you and it has helped you out. And as always, follow my YouTube channel, follow my Instagram channel. I post a lot of content, and the YouTube channel has recently become active. I'm doing a lot of scheduled content that is upcoming, so you might find these a bit more frequent. But Instagram is where all the fun stuff happens. So all the reels, all the comedy, all the motivational stuff, everything that I share is on Instagram. So make sure you follow the Instagram page as well. And yeah, see you next time with my next video idea. Bye.